Hi, my name is Chelsea Chandler.
And I'm Shannon Wilkinson.
Our other group members are Joseph Buckman, Samantha Wally, and Lauren Lovelace.
We read The Emperor of All Maladies, and we will be discussing radical mastectomy.
William Halsted was pretty frequently discussed throughout this novel, and he was actually the first person to start a surgical residency in the U.S. at Johns Hopkins.
So to keep up with the level of work that he wanted to complete, he used cocaine and actually became addicted to both cocaine and morphine. It was in 1882 that Halsted began performing the first of many radical mastectomies in the United States.
During this time, the radical mastectomy was the only known treatment, which we now understand is a tertiary prevention. The mastectomy evolved into the radical mastectomy through the thought process that more tissue removal would equal less cancer.
So the surgery was actually so disfiguring that women often couldn't hold up their arms or shoulders, and the recovery was very lengthy and extremely painful.
So these pictures give us a glimpse into just how radical these surgeries really were. And in the bottom corner here, you can kind of see the men all gathered around the table. And they called this the operating theater, and you can kind of see that they look like they're putting on a bit of a performance. These pictures here give a really good side-by-side comparison of what exactly was removed during a radical mastectomy versus a simple mastectomy. It wasn't actually until 1951, which is a long time after Halsted's first radical mastectomy, that it was really challenged by someone, and that was Ian MacDonald. He believed that slow-growing tumors didn't really need such a radical surgery.
So following closely behind MacDonald, George Crowe Jr. began offering a choice to women between radical and simple mastectomies in 1954. At this time, it was a very unpopular decision. This divide continued well into the 1960s, with patients also beginning to question radical surgery.
In the late 1950s, Bernard Fisher theorized that breast cancer was a systemic disease and that tumors that had metastasized throughout the body wouldn't benefit from radical surgery because these cells are in distant locations throughout the body. The different types of mastectomies included partial, simple, modified radical, and radical mastectomy. Today, the surgical options for breast cancer include modified radical mastectomy, simple mastectomy, which is the standard of care, and lumpectomies, which are really good for if the tumor is small and localized.
Additionally, varying combinations of surgery, radiation, and chemotherapy options exist today and help to improve outcomes. Overall, there has been a shift towards a more localized treatment.
Even with the broader scope of treatments that we have available today, early detection is still key for all cases of breast cancer. The radical mastectomy represented a tertiary approach, and we've come a long way in improving secondary screening methods such as the mammogram. And moving forward, there's a push for genetic testing, which would help us detect cancers even sooner. This image here shows steps that you can take to detect breast cancer.
So as public health professionals, it is imperative that we advocate and promote screening methods in the public, in addition to continuing research and test more effective prevention and treatment methods. Let's all defeat breast cancer together. Thank you so much.